The Charleston by Makeila Lee, Jaliya, and Olivia. And now a demonstration of the Charleston.
While moving through the dance step, we see that the movement in the ankles and feet are along the transverse plane. Both are switching between inversion and eversion. This foot placement would be considered inversion. While rotating the ankles, the tibialis anterior and extensor hallucis longus are the anterior muscles that are being worked. The posterior muscles are tibialis posterior, flexor hallucis longus, and flexor digitorum longus. This position would be eversion. The feet and ankles are both externally rotated. The anterior muscles that are being used are the extensors digitoria longus, and the lateral muscles that are being used are the peroneus longus and peroneus brevis.
Here, the legs are internally and externally rotating at the hip and knee on the transverse plane. There is flexion of both hips, and the knees go from flexion and extension. The anterior muscles of the hip being used are the iliopsoas, rectus femoris, and sartorius for hip flexion. The posterior hip muscles are the bicep femoris, semitendinosus, and semimembranosus for knee flexion. The lateral hip muscles being used are gluteus medius and minimus for hip rotation. The medial hip muscles being used are adductor longus, adductor brevis, pectineus, and gracilis for a lower range of hip flexion. Anterior knee muscles being used are rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis for knee extension. Posterior knee muscles being used are the gastrocnemius and the biceps femoris, semitendinosus, and semimembranosus for knee flexion.
Now focusing on the upper extremities, the arms are externally rotated along the transverse plane. External rotation of the arms from the shoulder joint, flexion of the wrists on both sides, and extension of the elbows are also taking place. The posterior scapular muscles are the trapezius, levator scapulae, rhomboids, infraspinatus, teres minor, and posterior deltoid. The anterior scapula muscles are serratus anterior, and the elbow muscles are the biceps brachii and the triceps brachii. All of these arm muscles work together to perform the adduction and the abduction shown in the video. As well as abduction and adduction, there is also a slight rotation in the transverse plane coming from the shoulder joint, which is the ball and socket.
The anterior spinal muscles being used are the transverse abdominis and psoas major. The transverse abdominis is used for spinal stabilization, and the psoas major is used for maintenance of normal lumbar curve. The posterior spinal muscles are the erector spinae, and it is for maintenance of an erect spine.
While analyzing the bodily movements, we realize that there is an open kinematic chain on one side of the body and a closed kinematic chain on the other side. The open kinematic chain is always with the working leg that is off the ground, and the closed is with the supporting leg that is connected to the ground.
Some potential pathologies and problems and deviations that could occur in her body would most likely be in the knee and ankle. Here, her knee is not properly in line with her ankle and not over her toes. This could be a potential problem. She could possibly get a medial collateral ligament injury in the knee. There could be possible sprain in the knee if it is not tracking over the toes properly. Also, when she inverts her foot, if she lands improperly on her foot, she could possibly sprain the lateral ligaments in her ankle. She could possibly get a lateral ankle injury. The ligaments are more susceptible to being sprained would be the anterior tibiofibular ligament, the calcaneofibular ligament, and the anterior talofibular ligament. In order to prevent this from happening, one should have strong ankles. Thank you for watching!
Okay, we're done.
Keep on going.
Sorry to mess up.
You're good.